The EzRay Air Portable Video User Guide, Chapter 8, Patient Positioning. In this video guide, we'll learn how to align the patient dentition with the EzRay Portable to capture the following: periapical x-rays for molars, premolars, lateral, and incisor regions, as well as bite wing x-rays for molars, premolars, lateral, and incisor regions as well. Notice: please review the recommendations as it relates to the video user guide and the complete user manual. Let's begin our patient positioning. In our alignment portion of this video, what we want to do is first again understand that we want the back scatter shield to be parallel to the operator. And what we're going to do then is tilt the occlusal to get the roots to be parallel then to the back scatter shield itself. So in this case, perhaps doing a periapical in the posterior region in the maxillary arch, we want to have the occlusal plane parallel to the floor. As we get from the premolar region towards the lateral region itself, this is where we're going to then tilt the occlusal plane to align the roots of the teeth parallel then to the back scatter shield, which is again then parallel then to the operator. As we get towards the anterior region of the arch, this is where we're then going to tilt the occlusal even further to get the roots of the central incisors in the maxillary arch to then be parallel then to the back scatter shield, which is again parallel then to the operator. So let's go ahead and discuss how we're going to align this with our patient in the maxillary arch in the posterior, lateral, and central incisal area, and the same thing in the mandible in the posterior, lateral, and central incisor there as well. To do this properly, again, we want to make sure that we are holding the back scatter shield parallel then to our patient. So starting in the posterior in the maxillary arch, having the occlusal plane parallel to the floor will then keep the roots of those posterior teeth parallel then to the back scatter shield. As we get towards the premolar and canine region area, we can then tilt the head in this case for demonstration purposes, but to get the roots of those teeth parallel to the back scatter shield, we'll go ahead and tilt the chin down a few degrees until it's then parallel to the back scatter shield. As we get towards the lateral and central incisor area, we'll go ahead and tilt the head down even further, again aligning the teeth so it's parallel then to the x-ray source. In order to capture images in the posterior of the mandible, again we'll align the occlusal so it's going to be parallel to the floor. We'll then align the roots so they're perpendicular to the x-ray source or parallel then to the back scatter shield. As we get to the premolar and canine region, we'll then tilt the chin up to get the roots of those teeth parallel then again to the back scatter shield. And then lastly, as we get to the central incisal area, for demonstration purposes, we'll rotate the head even further and then tilt the chin up higher. This will align the central incisors parallel to the back scatter shield. For bite wing images, we'll use a model here again, and from an alignment point of view, we want to make sure that the x-ray source is going to be as perpendicular to the teeth as possible. This will help open up the interproximals of the teeth to avoid or at least reduce overlapping of the teeth themselves. Going back to our patient, for all bite wing images, we want to keep the occlusal plane parallel to the floor and keeping the X-ray source parallel to the dentition, but also perpendicular to the interproximals of the teeth. The angulation of the dentition to the X-ray source can also vary depending on whether you're using a paralleling technique or a bisecting technique. And to improve success with your image capture, it's highly recommended to use a positioning indicator device or PID for your intraoral periapical images and bite wings. You should now be able to perform the following. Know how to align the patient dentition with the EzRay Air Portable to capture the following. Periapical X-rays for the molars, premolars, laterals, and central incisors, as well as bite wings for the molars, premolars, laterals, and central incisors as well.